Health expert and CEO of Proactive Health Solutions, Dr. Fundile Nyati, is hosting and conversing with the Minister of Health, Dr. Zwelini Mkhize, about his health portfolio later on tonight. This discussion takes place as South Africa this week began its vaccination program, which has so far seen healthcare workers across the country get inoculated with the Johnson & Johnson COVID-19 vaccine. The inoculations form part of the government's first phase of vaccinations, which were intended to target over 1 million healthcare workers. Amongst other healthcare areas to be tackled in this debate, Dr. Nyati is seeking answers on the current state of healthcare system in South Africa, the public healthcare service delivery challenges, the status of the national health insurance plans and rollout, and as well as the COVID-19 government response to date and the public protector's interim report on state of hospitals during COVID-19. He joins us now via Zoom. A very good evening to you, Dr. Nyati. Thank you so much for joining us. Welcome to the Globe.
Good evening to you, and also good evening to your viewers.
You'll be having a conversation with the Health Minister, Dr. Zwelini Mkhize, later on tonight. So what's the crux of this conversation, Dr. Nyati, and what do you hope will come out of it?
Well, I built the conversation as the pulse, taking a pulse of the healthcare system in South Africa. Basically to say, yes, we are in the middle of the COVID-19 pandemic. But the minister in 3 months' time will have finished 2 years as the National Minister of Health. So I wanted us to look at what has happened in the 2 years that he has been in that portfolio, but also what has been the impact of the COVID-19 to some of the things that he was doing to turn around the system that the previous Minister of Health had termed as a healthcare system that was in ICU. So it was really to understand where were we when he came in, where were we when COVID-19 came in, and where are we now? And how are we going to move forward as a country, seeing that, with COVID-19, resources of the country have been, depleted. And so do we still have enough resources for us to continue on the path of rebuilding the healthcare system in South Africa? So those are the things that I want to talk to him about. But also, we have this pandemic. It has exposed so many weaknesses in the country. We are so dependent on other countries for PPEs. We are dependent on vaccines. South Africa used to be able to produce its own vaccines, around 1994. But now we depend on vaccines from other parts of the world. We used to produce polio vaccine here. So I want to know, what have we learned during this pandemic, and how can South Africa be better placed and better prepared? Because this will not be the last pandemic that we are facing as a country. So I want him to share with the nation, where are we? He is the one who is at the steering wheel of this bus of healthcare system in South Africa. And he has the best, view to be able to look at what's happening at national level, at provincial level, where most of the delivery takes place, but also, issues that go down to municipal level. Obviously, that is under COCTA. So that's really what I wanted to understand. But also, what have been the good things that have come out? Because obviously there are challenges, but there are things that are good that have come out. What are those things? How can we build on those things so that we work towards this national health system that, or national health insurance that we've been, talking about as a country, so that it can bring equity in terms of access to healthcare for all people of South Africa. So I really want to know, as a result of this pandemic, are we now going to stop moving towards NHI, or are we going to fast track that process? Because countries like the UK have actually dealt better with the pandemic because they've got a national health system, many other countries as well. So there is a school of thought that we should actually move even faster to ensure that everybody has got access to healthcare.
Dr. Nyati, without preempting the content of your conversation that you'll be having later on with the Health Minister, and without, diagnosing the current ills that are currently facing the South African healthcare system, one may argue that, some, if not all, the biggest problems facing the current healthcare system is the corporate governance issues in South Africa, and where we are today, the South African healthcare system is in a bottomless pit and no coming back. So how would you approach that kind of, that kind of conversation if it gets to that?
Well, I think there are some truths that we need to say in South Africa. Now, we have a dual healthcare system in South Africa. We've got the public health sector that covers 84% of the population, and the private health sector that covers the 16% of the population. Now, we are made to believe that the private healthcare sector is actually okay. But the report that was, issued by the Competition Commission, the Health Market Inquiry, revealed serious ills in the private healthcare sector. All right, so that sector that we thought was doing well is actually in trouble over servicing, corruption, cartel behavior, and all of those kind of things. But on the other hand, we've got the one that services the majority, and that one is bedeviled, obviously, by a lot of issues of shortage of staff, issues of poor management of the supply chain of medicines, leading to what we call stockouts, low quality of services in some of the centers, like we've just heard about Tembisa and what happened to the young man who unfortunately died in Tembisa, with the report that came from the ombudsman. Issues of governance. We've got managers or CEOs of hospitals who are there maybe based on their medical qualifications, but they don't really have the competencies to lead and manage. And so that is actually creating a problem, because then resources are misused. Issues around technology, issues around strengthening of the primary healthcare system so that more people can be serviced at that level. So there's a lot of ills on both, health systems. And what we need as a country, was both of them are not sustainable. We do need to find a way to actually come up with this universal healthcare system. But it must not be something that is, a cut and paste from another country. We need to look at something that will work for South Africa, that will leverage the best of what we have in the public sector and in the private sector, and look at funding models that will work for this country. So I'm one of the people who are in support of the NHI, but it is the detail around the implementation that sometimes leaves some of us, having some questions. But I am in no doubt at this point that as a country, we will do better if we are actually able, to have, a restructuring of our healthcare system and proper funding of our healthcare system.
I suppose the big news making rounds in the healthcare front here in South Africa is the arrival of the Johnson & Johnson vaccines and the current vaccinations and inoculations currently taking place, especially amongst the healthcare workforce. Dr. Nyati, 2 Israeli studies have found that the Pfizer vaccine greatly reduces virus transmission, and we certainly cannot turn a blind eye around the debate on the efficacy of each vaccine. As you know, the Israeli, greatly supports the Pfizer vaccine, and the Johnson & Johnson vaccine, the South African government is supporting it as it's now being rolled out. And the AstraZeneca vaccine, not much is being said about it after it made its way here in South Africa, only to find after hitting our shores that it does not necessarily, cater or rather, deal with the variant of the new virus here in South Africa. And we only heard that it will now be taken to the African Union for redistribution to the other African countries which do not necessarily have the variant, and not much is being said about that. So should we be having the conversation around the efficacy of each vaccine?
Yeah. Well, you're right. There are 2 things that one needs to look at when it comes to vaccines. One, is it safe? That's number 1. 2, is it effective? Is it efficacious in terms of what it's supposed to do? That is to trigger immunity artificially, so that when the real virus comes, then you already have immunity. Now, each one of these vaccines has undergone what we call phase 1, phase 2 and phase 3 trials, and all of them have been found to be safe. That's number one. Then the issue is around efficacy. The 4 that South Africa has preferred, which is the Moderna, 94-95% effective, the one from Pfizer, about 94% effective, and then AstraZeneca was around 70-75% effective, but that was before it was tested against, the local variant, where it was found to actually be at around, 22%. But more studies need to be undertaken there. And then the Johnson & Johnson one is about, against this variant in South Africa, it's about 57% effective. However, globally, it's about 65%, effective, 66% effective. So these are effective viruses. But the challenge is, as vaccines are being produced, there is a moving target. The mutation of the virus and the new variants that are coming up. So by the time we took a decision of where we're going to buy these vaccines, we did not know, we had not tested these against the new variant that came around October. So, but the ones that were done in last, which is the Johnson & Johnson one, and also another one called Novavax, those ones have now been tested against this variant. So it is important that we are flexible and open-minded around these matters, because we are chasing a moving target. So I really do not want to blame the government around this matter, because no one could have foreseen that it will reduce the efficacy to the extent that it did. But further studies are being done, and hopefully with that, and some of the manufacturers are now looking at how to modify their vaccines to take into account the new variants. For example, the Pfizer and I think Moderna as well. So I think we need to, be able to understand that it is not, we don't have all the answers, but leadership is about also making decisions even when you don't have all the answers.
Well, Johnson & Johnson said on Friday that it has actually submitted data to the World Health Organization for emergency use listing the COVID-19 vaccine. So in layman's terms, Dr. Nyati, does that mean that the Johnson & Johnson vaccine has not been approved, yet South Africa has already started rolling it out?
Well, I think we need to also understand that as a country, we are a sovereign nation. We've got our own regulators, right? So now the study that was done and where the results were released, I think it was towards the last week of January around the Johnson & Johnson. It shows that this thing works, and yeah. So what we need to know is that what is our regulator saying, South African Health Products Regulation Authority. But there are ways of expediting the licensing of these things. So the fact that at this moment the jabs that are being given under the oversight of the Medical Research Council, so that we don't have to keep our people, especially the frontliners, waiting for these for these licenses. So they have decided that let it be done under some form of what we call phase 4, because after you've given, you've done the phase 3 studies, you still have phase 4, which is ongoing monitoring of, the use of the vaccines. So it is almost like a phase 4 study overseen by MRC, so that our people can get the vaccine because it's been proven to work, whilst the red tape is taking place, in the other regulators throughout the world. But at least that go-ahead has been given by our own South African Health Products Regulation Authority. So I think people need not fear, more so that there is the Medical Research Council that is having oversight over the rollout up until those regulatory matters are addressed.
I see you are allaying fears on the regulatory matters and, giving concern to the efficacy of the Johnson & Johnson vaccine. I mean, we know that the vaccine is the same as the one that is used in the other countries. So make me understand, Dr. Nyati, that the approval, is it based on the efficacy of each vaccine, or is it based on the socio-economic matters that are under consideration in each and every country?
Well, look, there are a number of things that any country has to consider. I think the first one is, has this, a biological preparation been tested through the necessary studies? Number one, has it been found to be safe? Has it been found to be effective? That's the first thing. Then number two, issues of cost. How much does it cost? For example, the reason why we went for the AstraZeneca vaccine was because it is the cheapest amongst the 4 that were identified. All right, and yet we're all going to be able to get a huge supply. But number 3, the other issues are then issues around, the relationships between countries. So one of the things I'll be asking the minister about is that, a vaccine from Russia, from Gamaleya, that is called Sputnik V, has been found to be about 92% effective and safe. All right, yet it has not yet been tested amongst, communities where there's black people and other, variables, people with HIV and all of that. So as much as it is 92% effective, but we still need to have further studies, for our own situation. However, it would even be good that it is found to work even on those populations that are here in South Africa under, the exposure of our variant, because we are part of the BRICS. Same as in China. China has got what they call Sinopharm, that has got a vaccine as well. And that Sinopharm vaccine is being used in some of the countries in the Middle East. And so there are many considerations: price, efficacy, safety, and also relationships within countries. Because the 2 that come from the US, the Moderna and the Pfizer, they tend to be expensive. It's about 500 rands a jab, if I'm not mistaken. The Pfizer one and the Moderna, they're somewhere around that price. Yet the J&J one is actually much lower, and definitely AstraZeneca is even, lower. Unfortunately, the cheapest vaccine was found, to have a bit of challenge against the variant, which is why it has now been put aside for further studies, or it be made available to other African countries that don't have the problem of the variant that we have here in South Africa.
Dr. Nyati, this is a very, very important conversation, and we certainly hope that we'll be in conversation with you, after you've had that very important conversation with the Health Minister. Thank you so much for joining us.
Thank you very much, and much appreciated.